Edition coronavirus news for June 16, 2020. Scientists at the University of Oxford reported promising findings in their search for a treatment for COVID-19. A steroid known as Dexamethasone was shown to reduce COVID-19 deaths when it was used in a 6,000-patient study. Researchers still have much to learn about exactly how the drug works on COVID-19 patients. It doesn't attack the virus itself, but it seems to reduce the amount of damage done to the lungs. They report it also softens the devastating inflammatory response caused by COVID-19. Another piece of good news, the steroid doesn't cost very much. Britain's National Health Service will begin using the treatment this week. The potential treatment couldn't come at a better time. China, the first country hit with the coronavirus, may be seeing a resurgence of COVID-19. The country has seen dozens of new cases in the past week, the most in several months. Beijing's largest wholesale food market was shut down as a preventative measure, and people in the city lined up for testing at a sports stadium.
We have continuously highlighted that New Zealand will have cases of COVID-19, particularly obviously at the border.
COVID-19 is back in New Zealand after 2 women returning from travel abroad tested positive.
What this does prove is the importance of a rigorous system at our border, of us continuing to be very, very cautious in our management and taking the cautious approach that we have continued to take as a government.
A COVID-19 resurgence is a concern in the States as well, as Inside Edition's Jim Murray reports.
Is the second wave upon us?
At least 19 states have seen an increase in daily new cases over the past 2 weeks,
including a 93% spike for Arizona in just the past week.
The mayor of Phoenix tells Inside Edition they reopened too soon.
We are seeing an alarming rise in cases in my community. Of all the COVID-19 cases that we've had in my county, 27% occurred in the last week.
And there's this ominous warning from officials in Houston, the nation's 4th largest city.
We may be approaching the precipice of a disaster.
By September, we're going to hit 200,000 people dead, and the pandemic won't be over.
Dr. Ashish Jha is director of the Harvard Global Health Institute.
States that are seeing these increases in numbers, I think it's really important for them to get people to start wearing masks, start building in some amount of social distancing, really think about banning large gatherings.
A reporter in Las Vegas was stunned when he stepped into this casino. Everyone packed together, no masks.
It's so hot.
One problem is the weather. As temperatures heat up, many people aren't wearing masks because they're just too uncomfortable. At Venice Beach in California, no masks.
It's pretty hot here today, and if you're exercising or even just walking around, a mask can make it difficult to breathe.
Make sure that you have a mask that actually is light in color because it won't absorb the heat the same way, and something that's a very breathable cotton.
Despite second wave concerns, President Trump is going ahead with his first rally since the pandemic lockdown in Tulsa next Friday at a venue that holds 19,000 people. They plan to fill it, and if anyone gets sick, they can't sue Trump. All attendees must sign a waiver. By attending the rally, you and any guest voluntarily assume all risks related to exposure to COVID-19 and agree not to hold Donald J. Trump for president liable for any illness or injury.
And Inside Edition Digital's Johanna Lee shares the story of one family's tragedy.
A 60-year-old man and his 38-year-old wife died just 1 day apart of coronavirus complications, leaving behind 5 children between the ages of 2 and 17. Luckily, these kids have a stepsister who will now be taking care of them, but she will also be taking care of her 30-year-old sister, who is currently hospitalized with the coronavirus and recently suffered a stroke.
There are over 8 million confirmed cases of COVID-19 and over 437,000 deaths worldwide. There are over 2.1 million cases and over 116,000 deaths in the United States.